Where someone gets up in the morning, they may be presenting with one or two challenges. They speak to the partner, say, don't worry about it, let me go back to sleep and think they'll get better in a couple of hours, only for them to delay the inevitable. I mean, do these type of things happen?
Yes, it happens very often. In fact, I think at least once a week I see someone who was afraid to come to hospital. And I think in most medical cases, if you come to hospital, the fear is that when you enter the hospital, we're going to say, this is your diagnosis. But in terms of stroke, if you delay or if you add time to that period, you're actually causing more disadvantages to yourself and to your future approval and prognosis.
My studio guest tonight is 27 after 4, is the world-class Dr. Devchand. She's a neurologist, practice here in South Africa, headed out to the UK, has been to France. So, in Liverpool, watch any football?
No, not at the time. I don't watch much football.
Really?
No.
You were in Manchester, you watch any football?
No, but I was opposite the manager's house. Well, I lived in Altrincham, so
Right.
his house is in Altrincham.
So which manager was this? Do you remember?
No, I can't remember.
Okay, was it Alex Ferguson, Louis van Gaal, David Moyes?
Alex Ferguson.
What, really? So you were his neighbour?
Well, the hospital which I worked at
Yeah.
was in the same neighbourhood of his
Yeah.
house.
But you didn't go to Old Trafford and watch any football? You spent time in London?
Yes.
You go and watch any football there?
No, I sent my dad for a match.
So you have no allegiance on Saturday because it's Liverpool taking on London on Saturday in the Champions League. Liverpool playing Tottenham.
Yeah.
So you wouldn't care who wins, right?
No, I'm a swimmer.
And that's good for your health, swimming, right?
Yes.
Okay, 25 minutes after 7 o'clock. My studio guest, as I mentioned tonight, is neurologist Dr. Dinita Devchand. We're talking about strokes this evening, and sadly far too many people in South Africa and around the world have passed on from strokes. And others then have very serious challenges because if you miss those markers, you go and seek medical intervention, too late, it does have huge impact on the quality of your life.
Yeah, certainly. The brain is a very precious organ. And so I'm not just saying that because I'm a neurologist, but it also has a potential of recovery because of neuroplasticity. And the more we train, if you tell someone, look, please practice this and you will get better, it's because of the neuroplasticity of the brain. So it has phenomenal capability to improve and repair itself. But having said that, I think when it comes to stroke, you really need to take the symptoms seriously. It's good if a family member can identify these symptoms. And we usually use some very simple mnemonic for the public. The mnemonic is FAST, F-A-S-T.
Right.
So look for slight or subtle changes. Is there a facial droop? Is the lip slightly different? Is the eye not closing? When they're talking, is their smile not complete? Is there a change in, so the F in FAST stands for face. The A in FAST stands for the arms. So if you tell them to lift up their arms together, is one hand dropping? Is there weakness in one arm? The S stands for speech. Listen to their speech. Is there a change in quality? Are they not able to say words? So they say something like, please move the shoe, and they say spoon, but then it's not just one word, but it continues. Is there a change in their speech? Is there a change in the pronunciation? Are they not talking, for instance? And the T is the most important, and that is time. The sooner you bring that patient to casualty for a doctor to assess the patient, and we can do an MRI scan or a CT scan, we can decide, does this patient meet criteria for this treatment? And is there anything we can do to help improve or salvage the area of the brain which has had no oxygen for the last few hours?
All right, so think FAST, which is face, arm, speech, and time.
Yes.
Could save someone's life, right?
Yes.
I mean, that's the important thing. Not all strokes are the same. You get different types of strokes, Doc.
Certainly, very different strokes. So this refers mainly to anterior circulation strokes where you'd get facial drooping and change in speech. But there are more complex types of strokes which present very differently. And that would really refer to the posterior circulation of the brain. And there's different areas and very different arteries which supply intricate areas of the brain which patients may just present with severe dizziness, with vomiting, and what we call ataxia, where they can't walk straight. And the husband or the partner will notice that, look, she's been very odd, she's been vomiting, she can't walk straight, she's complaining of double vision, and that's also something which should bringing awareness to, look, this might be a